It's Neurodiversity Celebration Week, and I'm sure that everyone here is aware, and there's been lots and lots of programs, and this is one of the programs. This one is powered by Africaness, and we're super excited to have this conversation from intent to impact, and we're focusing on removing barriers to neuro-inclusive engagement in underrepresented communities, which is really, really a very important conversation to have. My name is Dr. Vivian Okoye, and I am currently the Neurodiversity and Inclusion Lead at Africaness. My background is in health science with over 15 years of clinical and community practice in health sciences. And then I transitioned to psychology, where I did a master's degree in psychology and focused mainly on researching the help-seeking behavior of Black Africans, Black African individuals and families in the UK as it relates to autism. I'm also a trained neurodiversity and inclusion trainer. Trained the trainer, so I design and deliver trainings to individuals, to organizations, on neurodiversity and inclusion. Currently in Africaness, what we are focused on, or what my role is focused on, is essentially translating research to community, to application within the community. So we're involved with a lot of community engagement, a lot of community awareness, which also involves a lot of training development, co-productions, training designs, and training deliveries. So that is me. And what we plan to do here this evening is, first of all, we'll look at the research insights. So we currently run the Africaness Neurodiversity Program, and this is underpinned by a research that I carried out in 2023 in Newcastle University. So we look at that research insight, and we translated that research underpinned most of the programs that we have done with community engagement. So we will look at insight from that community engagement and what this means to us and the organizations we have here today. What does it mean? How can you use that information and improve what you're doing within your organization? Then we look at creating neuro-inclusive organizations for adult individuals from underrepresented communities. And then my colleague Adwina will come up to look at creating neuro-inclusive schools for children and families from underrepresented communities. And then at the end, we would invite you, because we are working on co-producing a communication toolkit, especially for people in the schools, a toolkit that can help you engage better with families from underrepresented communities. So I'm hoping that we all stay to the end so that you can know how you can be part of that. Please, as we proceed with the conversation, I'd like us to use the chat function to engage with each other, to engage if you have anything, any input, any reflections. You can also use the question and answer function for your questions. We have our eye on that to get all your questions. Questions are really important. We want to hear from you. This session is being recorded. Just to let you know that it's being recorded, and it's going to be shared at the end to everyone who registered for this program. And this is a 1 hour 30 minutes conversation, and we will try as much as possible to keep within that time. So why does this conversation matter? Why does this conversation matter? Many organizations, if you're here, you're definitely representing an organization, whether a school, a local authority, a private organization. many organizations are now being committed to inclusion. As the awareness for neurodiversity has grown, a lot of people are also becoming aware that they are neurodivergent. A lot of people are becoming aware. A lot of people are owning up to getting assessed. A lot of people are disclosing that they're neurodivergent. And in the workspace, seeing that growing level of awareness within our staff, within, the children that we serve. Also, we can all agree that in the last few years, that the population of the UK has increasingly become more diverse than it was in the past. So what this means is that as the population of neurodivergent individuals grow, there's also that increase in the population of neurodivergent individuals from underrepresented communities. But the question that we then have, which is a key question, is, are these individuals seeking support? When if there are services, if there are within organizations, there are reasonable adjustments, if there are conversations in organizations to be more inclusive, are the people in our organizations, the people that we engage with from underrepresented communities, are they really taking up the services and the support that we're offering them? And if they're not, why is that? And what can we do to ensure that, we're creating that more inclusive space for neurodivergent people in our organizations, and especially those of them from underrepresented communities? So while we reflect a bit on that, I'd like you to use the chat button to let me know what the key question is for you today. What is it that has brought you to this conversation? You're obviously joining because you work in an organization and there is a question that you want this session to answer for you. What would that be? What is the question that you want this session to answer for you? What is the key question when it comes to your engagement with people from underrepresented communities? If you can use the chat, just give it a minute to hear from you what your key questions are before we move along. Anyone? All right. While I wait for that to come, I'm hoping that it will come. Culturally aware. Davidson says culturally aware neuro-inclusion. Thank you for that. Yes, culturally aware neuro-inclusion. I'll wait for more people to while we wait for more people to respond to that, I'll just move on, right? So like I said, most of the work that we do in Africanness is underpinned by research. And in 2023, we did a research to identify the barriers for Black African families accessing autism diagnosis in the UK. And some of the things that we found out from this research is that there is limited awareness when it comes to autism. There is cultural stigma. There is misinterpretation of behaviors. People from our communities found the system very, very complex. Obviously, this one, everyone can relate to the long waiting times. And then there is the lack of culturally accessible information, right? This is the barcode here. You can access the research output, and it's also in the chat if you want to have that, right? And what is the impact of this? What this means is that there is delayed recognition when it comes to within the underrepresented communities. There is a lot of delay in recognition, in acceptance, and then in seeking assessment or support, there is a lot of denial. Individuals blame themselves, families blame themselves. It is masked, it is hidden, and this leads to a lot of mental, it exacerbates the mental health of individuals involved. There is anxiety and burnout, and support is delayed, obviously. And this doesn't end in childhood, because the research we have is for, is the sample was families who have autistic children, but this cuts across different forms of neurodiversity. And many times this delay, this denial, this make blaming themselves for their behaviors doesn't just end in childhood. It also, autistic children become autistic adults, neurodivergent children grow up to become neurodivergent adults, so it progresses. And based on that research, we did a lot of community engagement. We spoke to a lot of communities across Leeds and now in Bradford as well. And one of the things we're finding with the community engagement, community awareness program, community trainings that we're doing is that awareness alone is not enough, and trust is important. A lot of organizations have amazing support, amazing programs, amazing trainings for individuals, neurodivergent individuals, but people don't take up that support because there is no trust, right? Then within the underrepresented community as well, there is fear of stigma, and this fear of stigma affects help seeking behaviors, right? For example, within an organization, if you have a neurodivergent individual who is experiencing autistic burnout, for example, cultural conditioning can impact. Even though they're experiencing clear autistic burnout, they may not come up to express that because cultural condition says you cannot be weak. Cultural conditioning says you have to show up regardless. Cultural conditioning says you have to, zip it up and keep moving. So there is all of that nuances and all of that cultural context and that fear of stigma. The systems feel confusing or intimidating, right? The system is different if you have a person from from the underrepresented community who is working in your organization, for example, who has just migrated. They're just coming from a different system, a different work experience, a different work environment to a new system. It feels very, very confusing, sometimes very, very intimidating. Cultural understanding really, really matters. That regardless of the support, regardless of the reasonable adjustments, policies, and all of that you have within your organization, that you want to think about the cultural context of the people in your organization who are from underrepresented communities and how you can adapt that to fit their needs. So many adults that you would see who are working with you, whom you're engaging with as an organization, who grew up in the underrepresented communities, many of them might be neurodivergent, but it is not recognized. So in the workplace, even though they're neurodivergent, they might attribute their traits to personality. They will mask their differences. They would avoid disclosures. They will not seek adjustments. And there could be a lot of reasons why this happens, because for people from underrepresented communities, the stakes are a little bit higher. So in the workplace, this person's job or this person's visa might be tied to their job. So they cannot afford to present as weak, as inefficient, as asking for help all the time. There is also the cultural nuance, which I said earlier, where you're expected to be strong. In many African and Caribbean cultures, you're not expected to show up as weak. You're not expected to show up as always asking for help. So culturally there is that, being an immigrant in a workspace, having your visa tied to your work, there's also that anxiety where, an employee might be thinking, oh, maybe if I ask for a reasonable adjustment, that might feed into my performance. I might be seen as not performing well and all of that. So all of this play out, and individuals just rather keep going and not asking for help or taking the support that is being presented to them. So most organizations would have policies where adjustments are made or support is provided after disclosure. How then would this work for an individual who most likely hasn't been assessed, most likely is afraid to come forward, even when they can see that they're displaying some traits that might point to being neurodivergent? So many employees do not identify as neurodivergent. They would not seek diagnosis, and they will not request adjustments, right? So this is why, yes, within your policy, within your organization, you have that support in place, but you have this employee who obviously is struggling but would not come to access that support. So support exists but would remain inaccessible, as it were. Why? Because there is cultural silence, right? So culturally speaking, again, there is a culture of silence, there is a culture of shame, there is a culture of denial, there is the stigma, and most of these individuals would, whether consciously or subconsciously, would just rather try to continue going and not disclosing, and keep going. There is low awareness. So many times these people are coming from a background where neurodiversity is not a conversation, and there is limited awareness. Most of the traits or the behavioral traits that they're seeing might not be even associated to neurodiversity in their subconscious mind. They're thinking it's a personality problem. They're thinking it's their own limitations. So that awareness is not there. Therefore, delayed recognition. Therefore, the masking. Therefore, the burnout and exclusion. So what are the key learning, and what does effective engagement require? Effective engagement will require organizations to be more culturally aware. Effective engagement will require organizations to think about how can we build trust, right? How do we, now we have this support in place, and these individuals from underrepresented communities are not coming forward to take this support, obviously because there is a trust gap. Like I said, how do we build that trust? How do we communicate? How do we make communication accessible? And it will require sometimes, depending, for example, local authorities, schools, sometimes it require partnership with communities, right? And thinking about what you have in place, thinking about your policies, and thinking, understanding that there is no one size fits all, because most times the support available is built for a certain demographic, because that is the data that is available. These are the people that come forward, and then we want to apply that to everyone. So we want to go beyond that and understand that there are contexts that we might have to consider when we are trying to engage with people from underrepresented communities. And what this means is a shift from awareness to action. Yes, within your organization, everybody is aware that you have a policy that is inclusive, you have support available, you have reasonable adjustments. the awareness is there. What does action look like? You have to move beyond awareness to action, right? So action might look like, yes, we have this in place. Are the managers trained to engage with their downliners, for example, on a personal level, to identify needs and to speak to them one-on-one and encourage them to accept the support and even reassure them that this does not affect their performance? So these are like the in-betweens that will move that awareness into action. And this will also mean a shift from policy to practice. Yes, the policy is in place, how practical it is, right? This would also mean shifting from access to inclusion. Yes, we have made everything accessible, but is it accessible to everyone? Is what we have made accessible to everyone? Is it nuanced to, meet the needs of everyone? Is the cultural context, is the perspective of people from underrepresented community captured in what we have put in place, right? So design systems that work even without disclosures, for example. So while the support is given after disclosure, cultural context, or the context that, as we have shown in this conversation, if you're saying that the support you have in place will only come in place if somebody is assessed, diagnosed, and comes to disclose within your organization before they can have access to the support you have in place, then you are naturally excluding some people who may not have that opportunity, or who may not be as privileged to have recognized that they're struggling and it's neurodiversity, and who may not have the courage to go forward to get the assessments or come forward to disclose that they're struggling. So what does creating a neuro-inclusive organization, what would it look like in practical terms? It will look like normalizing neurodiversity conversation, right? And when we say normalizing neurodiversity conversation, I know that it is quite mainstream at the moment, but one thing with subconscious bias, one thing with community conditioning and cultural conditioning is that it still would serve as a barrier. While that conversation within the organization is, up and forward, people from underrepresented community will still have that mental barrier to actually being accepting the information available. So normalizing and having that conversation repeatedly might be what would be required to move past that mental barrier, that denial that is standing in their way of accepting the support that is available. Clear information about adjustments, clear information, and also reassurance that taking up adjustments does not imply that you are underperforming, because like I said, that is really, really important. For people in the underrepresented community, we have found through community engagement is that having the neurodiversity conversation from a strength-based approach is really, really important. Language matters. When we're having it as a deficit, when we're presenting it as being neurodivergent makes you less than, or being neurodivergent means you're struggling, culturally speaking, and most people from our background in our communities will not want to identify with that because of the stigmas around that as well. So language is really, really important in how we have that conversation and help that reassurance that it does not mean coming forward to disclose, coming forward to say you're struggling, coming forward to say that you need some adjustment doesn't necessarily mean underperformance, right? And managers need to be trained in, it's really, really important because many times organizations would have the structure, organizations will have the policies in place, and people are not even aware that maybe the struggles they have might be pointing towards being neurodivergent. So it's important that managers themselves are neurodiversity aware, and that they can recognize when, for example, when an employee is struggling with focus, organization, an employee is, having a burnout. So they can present that support not just with the label, but more as a need basis. So if you're struggling with organization, for example, yes, you don't have an assessment, you're not diagnosed, but this is what is, and we have this adjustment for you based on what we're identifying as a need for your own professional development within the organization. Recognize cultural differences, right? While we have this conversation, it's important that we recognize like the context around different cultures, where people are coming from, what this might mean for them when it comes to having conversations around neurodiversity, and that will shape our language, that will shape how we engage and build safety within organizations as well. People need to feel safe if we want them to disclose, if we want them to come forward, if we want them to accept the support that we're providing them. People really, really need to feel safe. So building that psychological safety is really, really important. So what does it mean moving from intent to real impact? There are questions we need to ask. Are our systems accessible to all communities? So the system that you have built, the support that you have built, the conversations that you're having, is it inclusive for everyone? Are you carrying everyone along? Are the people in your organization who are from underrepresented community, are their voices included in your co-production as well? That's really, really important. Are we designing workplaces for diverse thinking styles? Really important. While neurodiversity in itself presents us with that diverse thinking styles, the context around culture is an addition to that as well. Are we listening to lived experiences? Lived experiences matter. Where we come from matter. The experiences that have shaped us matter. The culture that has conditioned us into the people that we have become really, really matter in this conversation. Yeah, so this neuro-inclusion model by Jessica Dark really just wraps everything wraps everything up, as we talk about like what neuro-inclusion should look like. These are like the 8 principles, she said. And what it means is respect is important. Representation is important. Like I did say earlier, in designing the support, in designing the policy, is important that everyone is represented. It's important that the voice of everyone is captured, because you cannot really design something that will work for somebody that many times you haven't walked in their shoes, or many times you don't understand their experiences, or many times you don't know their context. So it's really, really important. Dissemination is important. How we disseminate what we have in place, how we share that information. It's really important and it can shape if somebody would accept or not accept, or if somebody will feel included or not included. Language choices, strength-based, right? Instead of framing it or framing the conversation in a way that makes somebody feel deficient, it's important that we frame it as support, we frame it as inclusion, we frame it as strength, as it were. Actionable outcomes. What are the actions we want to take? What does action look like when it comes to inclusion within our organizations? Remove barriers as much as possible. So, for example, a major barrier is disclosure. Many people would not come forward. Many people from underrepresented community will not come forward to say, I need help, I want help. The help-seeking behavior for people in the from underrepresented community is different. There are a lot of research out there. Before so many people from African and ethnic minority background comes to seek help, then it would have been that they really, really need that help, right? It would be at crisis point for most people. So remove that barrier and, reach out, let the managers reach out, let the managers observe where help is needed and reach out to actually offer that support. Include participants, learn and experiment. When it comes to neurodiversity, it's a continuous learning. We keep learning, we keep adapting, we keep experimenting, and it's the same within organizations. While we improve our policies around inclusion, while we try to make our workspaces a place that includes everyone and accommodates everyone, it's really a learning process, and we'll keep on learning, we keep on adapting, we keep on experimenting. But it's important that the voices of everyone is carried along in whatever you're developing to support people within your organization, right? So I will then bring Adi to come up and speak to us about what this looks like within the school and engaging with families from underrepresented communities, families on behalf of their children within the school context. Adi.
Thank you, Dr. Vivian. Just a little bit about me, so you know a bit about my background. I started in education about 20 years ago, just as an assistant. And then I moved from my home country to the UK, where I also continued as an assistant in the classroom. Presently, I work for the local authority, but I initially started as an inclusion officer. I wrote education, health, and care plans, and then I transitioned into the psychology department, where I was an assistant educational psychologist. And I very recently left the bridge between social care and education. So I worked a lot in safeguarding and with residentials and trauma-informed practice in schools. And presently, I work with my local authorities, local area committees. So I work a lot with communities and building those new and inclusive practices. So, and I'm also a volunteer governor at a school for SEN. So tonight, when we talk a bit about inclusion, I'm going to include all of those experiences, including my governance, because we've very recently had our Ofsted inspection using the new framework. So to start, inclusion in schools is not always essentially just a support plan or writing an EHCP or making adjustments or putting them in a group. It's also about whether or not the families and the children feel safe. And again, we know that part of the curriculum and part of the Ofsted framework means ensuring that students are feeling that they're included. So the new Ofsted framework essentially is looking for evidence that this is what's happening in the classroom. It's kind of moving from, yes, we know this is written in your policy, but we want to see that it's actually happening in practice. So a lot of the questions that we received, that parents received, governors and students as well, it was looking at real lived experiences of everyone in the setting. So did they feel that they were a part of the school family? Did they feel that they belonged in that community? So there's a big focus now on having schools do more than just say it's part of the policy. They want to see it in practice. So what Ofsted is looking for is, can all students access the curriculum? Is the system fair and inclusive? And are any groups being excluded, overly disciplined? And again, is it being identified accurately and early? So this is where we're finding that this new initiative from us, Ofsted, is looking at the intersection between race, culture, and discrimination in the way that we're identifying needs in school. So although Ofsted doesn't say this explicitly, the new framework does focus a lot on disadvantaged groups, equity of outcomes, and barriers to participation. And as we do know that, um, ethnicity and cultural background is a protected characteristic. So this includes learners that speak more than one language, migrant families, Black and Asian communities, or just communities that may have a lower trust in the system. And so, what we've noticed through Africanus and through our work is that sometimes everyone means well, they're doing the best on paper for inclusion, but sometimes in practice, this can be a little bit more difficult to put into place. Um, and this is typically evidenced by, as we know, kind of disproportionate referrals and misinterpretation. So, what I'm hoping to do this evening is essentially share part of the reason why we feel that there's a high emphasis on referrals and misinterpretation of behaviors for lots of Black boys and girls. They are excluded more likely, less likely to be referred for needs. And again, some of you have already noted in the chat why this may be, but again, we will get to that. Um, but this doesn't mean that teachers are intentionally being biased or intentionally going, this is just this particular group of students. So, having worked in education, I do understand that how the system works and how educators are obligated to report certain things, but in the best interest of the student, you want to know that they're being included. And the way that it works or that teachers look at it is they will say, well, I need this child to achieve. What can I do differently to help them? However, what we do know realistically is that unconscious bias does exist, meaning this is not a purposeful thing. It's kind of a learned behavior based on the way lots of us grew up. It's very different to today, where lots of things are addressed, whereas previously we did not talk about perhaps the things that went wrong in society, or a lot of what we saw even on television and in the news growing up. We've noticed that there was an underrepresentation of certain communities, or these communities were represented in a very negative way in the media. So, unfortunately, this can create kind of a subconscious bias. That means you tend to act in an automatic way. So, I'll give you an example. My friend, she is a white British lady. She is married to an Asian man, and it was Christmas time, and she was doing her shopping, and a Black lady came to grab a particular seasoning, and my friend was very annoyed because it was the last one. And really and truly, my friend kind of pushed the lady to get it. So the ladies obviously said, that wasn't appropriate. And then my friend said she immediately went, well, oh, she's acting this way because of her race or her cultural background. And my friend realized her thought almost immediately, gave her the seasoning and moved on. But it is a really good example of unconscious bias because it shows that kind of instinctive response that we may not even be aware that we're doing. So again, you feel free afterwards. We don't have time this evening to go through it, but just have a Google and then have a think. Is there anything that pops up in those moments where maybe, particularly when you're tired or when the classroom is busy? And I know for those in the health profession, it's just go, go, go. Everyone is overworked. There's never enough time or enough staff. And that can have a really big impact on us and our kind of immediate responses to things. So just keep those things in mind. And again, it's one of those things where once you're aware of it, like my friend, you can respond differently and practice and keep going, and changing those kind of interpretations. So an example of misinterpreted behavior, and this is just one example, um, is in West African cultures, some children are taught that direct eye contact with adults can be disrespectful. So if a child is being corrected, they may look away, they may look down, and that is a sign of you respecting your elders and respecting that you're being corrected and that maybe you made a mistake. However, as we know that in the very Western UK context, this can be identified as an additional need. The child maybe has social difficulties because they can't make eye contact or they're disengaging. They might have a lack of confidence. So, this is one of those examples of an interpretation of behavior that, if you look at it culturally, may actually have a different meaning. So, this is what we mean by, is inclusion in practice, or is this something that we've just written? So, part of it is getting to know your families, getting to know their backgrounds, getting to know their why they do what they do, and having that understanding, because it may not be an additional need. It may just be this child thinks I'm behaving in the way that is appropriate, that I understand, and that is being respectful to my teacher. Another thing we can do as educators is rethink how things are being assessments are being how children are being assessed. One of the things we know, and this was mentioned earlier, is that lots of the standardized assessments are very westernized, and the expectations are built around the cultural expectations within the UK. So rather than using those standardized assessments, and I know lots of you have to then go work with the educational psychologist, you have to go and work with your Senko. So what you can do is have those conversations about using a different kind of assessment. So what can you do differently? And when you approach your Senko or whichever service you're going to go, you're going to bring the classroom observations as you normally would, but you're going to add that cultural context into that observation, meaning what does this look like for us, for this student? Is there perhaps a reason why maybe they're looking down instead of not engaging, instead of just assuming? You're also going to have conversations with the family. You will be typically doing this anyway at parent-teacher meetings, but before you make that referral to your Senko or follow up with them, you're going to speak to the family and say, I think maybe can we have a conversation, or why do you think he does this? Or I've noticed a particular behavior. Can you explain this to me? Language is also really important, how we speak to parents. Lots of times we use very specific jargon related to the UK and related to SEN that, as Dr. Vivian said, the parents may not understand. So they come in, they're a bit confused, and then you say something like neurodiversity, and they're a bit like, what does that mean? So rather than engage with you and say, yes, we're going to go forward with this, they say, I'm actually not quite sure what this is. So they will maybe back up a bit. But if you rethink the assessment and how you're going to explore this child's behavior, then it will have a better advantage. And part of doing that is having the conversations with the parents to see what this actually looks like for them and at home and what it means for their family. These are some examples that I've pulled together for you to, if you want to have the conversation with your local EP or your Senko. So dynamic assessment, again, it's more of an observational based assessment, but it's based a lot on context. Ecological assessments, classroom observations, and again, collaborate with families. So maybe have that communication about what works at home, what works at school, what can we do differently. And we do this generally as teachers at kind of our first base level intervention, kind of our quality first teaching. But what you can do at this level is make sure that you understand where the parents are coming from, what certain behavior looks like for them. Because again, the example I gave you is just one West African culture. And as we've noticed, there's loads of cultures here. So make sure that you're communicating with the families and try to build that relationship and that trust. Um, so that you can also consider what other needs might be. And then you also find that families will be more communicative with you if they trust you and they believe, you're doing this for their child and you really care about their well-being. Culturally, a sense of community is very important. So building that trust with your child's teacher from a culture would go a very long way. Um, As mentioned earlier this evening, so I won't spend too much time on it, cultural perspectives of neurodiversity can vary across cultures. Sometimes it can be understood, other times it is quite an unwanted label. You may be ostracized by your society, as others have put in the chat, because there may be a lack of understanding around what neurodiversity means. Lots of times students are just, or young people actually just thought, well, they have a quirk or they're a little bit weird, and then parents just think, well, there's nothing wrong because they seem typical. Kind of all of the I don't want to say that the responses about people that don't really understand neurodivergence will go, well, maybe you don't seem autistic. You don't seem like you have ADHD. It's the same thing across cultures, just how people present with their understandings can be different. So it's not the parents being defensive or even hesitant. There's a cultural background there sometimes that might be I'm worried about how this is going to look for my family, meaning, can I go home and say to my family my child has been diagnosed without it becoming an issue? And sometimes it's a bit of fear because parents do not particularly understand the system here. So there are loads of different names across the world for special needs. Like I said, sometimes here there's a lot of emphasis on the terms and the acronyms that we're using, but parents may not have this understanding. So I would really suggest breaking down your language, adjusting how you would speak to the parents, and how you would engage with them. So rather than exploring, for example, your child's exhibited this behavior, it's about understanding that behavior is culturally shaped and communication is culturally shaped. So rather than saying to the family, we believe your child may have an additional need, you can just say that we think he needs an additional support in the classroom that may help improve his learning because he is working at this delay. So have those kind of conversations first before you move forward, and then before you make those, so you have a better understanding of the family and their needs, and then move forward when you want to actually have those conversations. Make sure that you're being culturally sensitive and how you present this information to the family. But again, if you've built those relationships from, your initial parent-teacher meetings, then you would have some understanding when you do move forward. I did just touch on this. So there are lots of negative experiences, as you may have seen in the chat, that some families have experienced either themselves or their own children. There's a lot of blame going around. There's culturally sometimes the expectation to behave a certain way in every culture, a certain way in public. So sometimes parents feel that they will perhaps be blamed for their child being labeled, or maybe they did something wrong. Um, because cultural differences, as I said, in some cultures, you can be ostracized, you can be, um, people will be less likely to want to be around you or to support you. Um, and then will professionals, some parents may wonder if professionals will understand their context. So it's that parents, again, that communication balance of, do parents understand what you're asking them and why, and do they trust you? As I said, trust is a very important element um, of most Black and Asian cultures and Caribbean cultures as well. As I said about the sense of community, one of the things that we talk about a lot with parents and the communities I support is how, when lots of families come over, they are used to example their children to play out in the street, but that is not something that happens here. And the reason parents can do that in other cultures is because everyone is looking out for your child. So even myself, for example, if I'm outside and I see a child on the bike, it's perfectly normal in my culture to stop and make sure that child's okay. Where's your mom? Where's your dad? So it's a little bit different when you come, and the culture's different in that people aren't that as communicative with people they don't know. So it becomes this kind of different feeling for the families that are here, and maybe possibly even a bit of homesickness, and they start to maybe go into themselves or just to their own community. So from the initial start, try to build trust and engagement with the families, otherwise it becomes a bit difficult going forward. Communication barriers, as I said previously, there is lots of educational jargon, lots of SEN jargon. There are lots more processes here than in other places as well, and it looks a bit different. So for example, in lots of other cultures, being told that you have an additional need as a child means your child's automatically kind of going to a specialist space, and it's not the same. Whereas here, the classrooms and the settings are different. So parents might be thinking that if you say my child has needs, you're going to then try and put their child in a specialist school, not that you're actually just going to make adjustments. They're going to get additional support, maybe communication changes. So try to break it down as much as you can. And if possible, and I know this is very, very difficult for schools, but if possible, try and get an interpreter if need be. If that is not possible, Then try and ask the family to bring someone who maybe can interpret for them to let them know. Make sure that that family knows exactly what you're trying to explain and how the system works. Lots of families, for example, don't know about sendias referrals, so you can let them know there is this system that will help you understand, or there's this program that will help you understand the system in the UK. So make sure you're signposting families as well and let them know what's available. Again, having this information available in schools, in your office, might also be useful if you have a high number of varied families. So again, inclusive engagement, when you're having those initial conversations with your teachers, with your families and with your young people as well, particularly as they get older, you need to understand that there's lots of different contexts. And so particularly for our young people, they are balancing two different worlds at the same time that they're doing the most development and growth at that time. So as the children get older, if you're working in secondary school, you want to be having those conversations with them about their culture, about what it looks like. You also want to make sure that you're demonstrating inclusion around the school, so that child, a teenager or young person, sees themselves represented. This is not just about what's in the curriculum, it's about the staff that are hired, the people that are there. Do they see other people like them um, around? So make sure that you're having those kind of conversations, that when you're speaking to your senior leadership, you're having those conversations about what maybe you can do differently as a school to focus on including the entire family and building that whole school community, and avoiding those kind of maybe unintentional assumptions about what it looks like. So include the student, include the family as much as possible. Lots of times we do kind of those generic cards that we give out for education purposes, or feeling cards. Very rarely do those cards include children from various backgrounds. So either you can include them yourselves, or you can get a card that has generic characters altogether. But it's about finding ways to make sure that members of that community, or members of in your school community, see themselves represented. Um, Again, from awareness to practice. So seeing quite a lot of you here this evening shows that you're just increasing your own cultural awareness. And this is something, of course, that you want to take back to your staff. So if you are a senior leader in education today, you can go back and feedback to your staff and say, share what you've learned this evening. You can also contact Afrikindness or other charities like us about training and making sure that you're learning more about education and what this education and neuro-inclusive practice, and how you can support us. And like we've said previously, building those partnerships, community organizations. If you're not sure, more than likely where you are, there is a local community for various groups in the area. So you'll find a Nigerian community, a Caribbean community. Go to them and ask them, we would like some feedback. And more times than not, they're very willing to help. They're very willing to come and have some conversations with you. Or nowadays, you can just Google it and look things up. But the best thing to do, as always, is to discuss. And again, everything we know about the Child and Family Act, the SEND Code of Practice, all discussions related to SEND should be collaborative. Parents and young people are allowed to share their views on what adjustments are being made for them, and you should be, as professionals and as educators, including this in your sessions and when you're having your SEN reviews when you do get to that point. So in practice, this requires an understanding of how culture, race, and systematic experiences shape children's experiences in school. So, as we mentioned earlier, some of just the identification principles for certain needs are kind of othering or creating a higher system for certain cultures, meaning they're more likely to be referred just for behaving in a way that they feel is appropriate based on their upbringing. So it's about understanding behavior, but in a culturally informed practice. So in African cultures, we've had the conversation about eye contact. In Asian cultures, sometimes there's an emphasis on quietness. So again, it doesn't necessarily mean that there's a communication need. It means that they're respecting your authority. So one example I had in university, there were lots of Chinese students, and the teacher would ask us to challenge theories in psychology. And lots of my fellow students would not speak up. And it was because the teacher was a position of authority, and for them it felt wrong to challenge it. So the entire emphasis and lesson that she was trying to teach actually didn't work because culturally there were too many students who felt it inappropriate, so they did not engage with the lesson. You need to keep that in mind when you're teaching, when you're assessing, and when you're having those conversations with family. So is this child communicating respect? Are they communicating what they understand in their own culture? And again, think about the stress and all of the masking that the child has to do. So I'm sure for children who come from other countries, there's always that bit of confusion because this is how I have to behave at home, but then I go to school and they say I need to do this. There's a bit of conflict there because students are then wondering, well, what is my next step? How do I behave here? And then parents will be confused and frustrated because they don't understand why you're concerned about their child not looking at you. And unless you're aware of it, this is not something you will think to ask. That the parent won't think to you, have you made this decision based on eye contact? They don't know how autism or ADHD assessments are made. So again, have the conversations about why you've chosen what you've chosen, what the behavior looks like for them, and then what does this behavior look like for you, and get a better understanding of the cultural context. Again, we touched on this earlier. There should be representation in the school environment. And again, this goes a really long way with Ofsted, not just in the books, but in the curriculum as well. So, for example, we know that there's Black History Month in October. Have you done anything for that? We know that Eid is coming up in 2 months. Are you celebrating any of those things? If there's a variety of cultures in your school, are they represented? Are there flags? Are there pictures? And lots of times there's kind of a performative image. There's one image of multiple cultures, maybe on a web page or at the front of the school. But Ofsted themselves are now looking for what this looks like in the classroom. They want to see, are there books with children of color? Are there stories about different students and different backgrounds? There was one particular school where I went to do an assessment and a review. And this school had a large number of various backgrounds, including Pakistani, Indian, Nigerian, Kenyan, Ghanaian. I could go on, Eritrean, there were loads of them. And the school, as you know, in the high school curriculum, it can be amended. And the school decided to put in a second language. And one of the things I had to ask was why. Majority of the children in the school already spoke second languages. And then the language that the school chose to put in was Spanish. And most of the students in this area were unlikely to travel. And the reason the school chose Spanish is because they felt, well, when British people travel, they're going to go to a Spanish speaking country, so maybe it'll be useful. So it was really an example of how the school did not observe the environment and create a curriculum that actually supported their students. Those students could have gone on to build on both languages that they already knew. Um, Rather than introducing a language that was not particularly easy for them to use or that they probably wouldn't use later in life. And the school could have again done other things to support them rather than introducing another language. There are always options. And again, one of the things that we do at my school in governance is we regularly send out feedback to parents. So ask your parents when you're sending out those questionnaires, if we make adjustments to the curriculum, what would you like to see? What could we do to make you feel included? Make sure you're asking those questions, not just as a teacher, but the senior leadership team as well, so that it's more than just a strategic and policy thing, that it becomes something that's operational and in practice. The other thing to remember as well is for speech and language, EAL, again, sometimes with assessments, do not take into account that the student may not just may not understand in that language. But again, it's one of those limitations where the system and the assessment is designed in a particular way. So it may be that, again, you have these conversations with your specialist services that come into school to support you. Say, for example, to your speech and language assessor, this child has another language at home. I'm not really sure if it's language or if maybe it's needs, and they'll be able to help you identify it. And again, if you make links in the community, you might be able to find a support service to help that family or to have an interpreter available to help do the assessment. Sometimes this is possible, but again, I'm fully aware of how difficult this may be in practice to actually get an interpreter available. But this is why we're here to hopefully try and build some various policies and practices. So, review again the current policy. So, Black pupils in England are significantly more likely to be excluded from school. Um, So one of the things that we should look at is, in the first instance, why these exclusions are happening. We do know that sometimes communication differences, so for example, a student may be more animated in how they present themselves. We know that sometimes anxiety can come out but look like anger. So it's about identifying what need is there in the first instance, and inclusive schools will be looking at their data, be looking at their exclusion patterns and going, well, we've identified this core group is consistently being excluded. And then they go back and they identify why. Why is this happening? What time of day is it happening? What can we do differently to make sure? And this is a constant review. It isn't something you do once a year. You should be meeting with your governors, or your senior leadership should be meeting with your governors at least termly to go through this data, and they should be developing a plan. And again, as teachers, you are able to say, maybe I've noticed this. Is there anything that's happening? And again, your school should have a teaching representative on their governing body. If you feel so inclined, you can take this role and maybe bring this up on the board. But again, as parents as well, you can always email the school to bring up any issues that you feel may be there. But again, also, as we said earlier about unconscious bias, um, or perhaps systematic patterns, is there any bias in the system? Is someone looking at something from a very narrow perspective or point of view, as the other school was doing previously with the language barrier? How can we support our students from where they are, from their own backgrounds, and take them further? Right. And then again, culturally responsive send identification. Take a moment. You should be having those conversations with families, getting to know them from the outset. Again, I'm aware this might be a bit more difficult in secondary because your parent teacher meetings are a bit spaced out, and you may not have the time that you wish you had to call every parent and ask them for feedback or inclusion. But if you're able to, particularly if you're worried or you have a concern, contact that parent, send an email so that you have a better understanding of that family's cultural needs and background. That is it from me for the moment. I have seen that there are some questions popping up in the chat. Um, but if you do have any questions or anything, please feel free to pop them in the chat, or there is a question and answer section as well, if you would like to post it in there. The verbal, just reading a comment from Anna Rose. Um, I found unfair treatment of children with different skin colors, especially where they are boys, especially those with verbal differences or in need of AAC devices. This is not fair, but there's little training like this to assist understanding for staff. So this thing is very valuable. Thank you. I'm really glad that could help. And that's what I mean. I understand the lack of resources available. So I wanted to try and make my advice practical, but it can be difficult to make it happen within the systems as they are, with just getting resources that you need to make things happen. I will give
Yeah.
you a minute or two
So
to ask questions.
yeah, Adi, were you saying something?
No, I said I would give everyone a minute if they had any more questions.
Yeah, we had some questions earlier. Um,
Okay.
maybe we'll read those out as well. So Matt had asked, how are neurodiverse affirming practices impacted by cultural context?
Is that in
Um,
the chat? How are neuro? Say that again for me. I'm just scrolling
how
up. to see it.
How are neurodiverse affirming practices impacted by cultural context?
Um, is that for you, Dr. Vivian? Is that educational or?
Well, either ways, so when we talk about neurodiverse affirming practices, with everything we've said here, yes, everyone is on the same page in the sense of, affirming neurodivergent individuals. But what we're saying is, when it comes to cultural context, you want to think about what experiences have been, the subconscious conditioning that individuals from cultural backgrounds might have that might pose as a barrier, um, to them engaging or to them moving past that phase of denial, which is even the first step, and then engaging or accepting. So it's really, like we said, engaging in a way that is it's more strength based, engaging with, building trust, and that's why organizations like, um, Africanness exists, because if you're trying to, get resources or get training or train staff or train team on how to engage, or how to understand those cultural nuances based on what you already have on ground in terms of your practices. One of the things we do is to look at what you have on ground and then think about what cultural context might mean, in the sense of the people you're trying to reach, the demographics, and all of that. It's really, really not one size fits all. It's bespoke when we think about it. So it's really, looking at what you have on ground in terms of your neuro affirming practices, and thinking about who you want to reach and what their context is in terms of their culture, and how best to apply that context into what you have, so that it will resonate with them, they would trust it, and they would engage with it. I hope that answers your question. Someone had their hands up. I have to go now. Please find me on LinkedIn, and I would like to connect and talk further. This is very valuable. Anna Rose, thank you. We would look for you on LinkedIn. Talkers, please take note. Do we have anyone? Any questions? Any questions? Any more questions? Someone said, "How do we move through denial?" How do we move through denial? Adi, do you want to respond to that?
Yeah, I think, like I said earlier, it's part of how you communicate the difference or the need to the family. Um, Lots of people can feel like there's nothing wrong, it's just a quirky personality trait, or not at all. I've also learned that for some people it's religious. So it's about how you address it with that family, and again, about building those connections and getting to know them, if
Yeah,
possible, prior to sharing that information. But connection and communication is very important.
yeah. I'd like to add, to that, especially when it comes in the education setting. Education and achievement is a big motivation for many people from underrepresented communities. For many migrants who have left their country to come to the UK, one of the biggest motivation is wanting their children to have education, to have better opportunities as compared to what was obtainable from in their home country. So when you come with that first information of, this is what we're seeing, a parent might just read it as, this is a barrier to my child achieving or attaining, and that immediately they want to, just deny that. So it's really, really important, and that's why we think about language, why we think about, like Adi said, having a strength-based language where, also, a lot of people are afraid of the label and what that might mean for them. So initially, it might be identifying the needs and speaking from a needs point of view, and offering your support in a way of, meeting needs and improving improving engagement with academics or improving engagement with learning. So it's really how it is framed in a way that also feeds into what motivates or what's important to that family at that point. It I hope that helps. Do we have another question?
There was another question there I think might be helpful. It's not from an education perspective, though. It's from a health and accessibility. So looking for ways to make it work at the intersection of cultural and neuro-inclusivity. I apologize. Cultural and neuro-inclusivity. But from health and an accessibility perspective.
Mhm. Yeah. Someone says there are societal challenges when autistic young Black men commit violent crimes. How do we go about promoting neuro inclusion so that we address stigma and empower families with children displaying violence? Um, One of the easiest ways to reach families is through community engagement. Um, if you want to get through to families, you want to get through to where they're already engaging and then having that conversation and building that trust and then presenting whatever support you have available. Many people from Black and ethnic minority communities are already engaging in communities, either national communities, faith communities, communities like Africanist communities as well. So promoting that neuro inclusion and providing that support for families that are have children that are displaying violence or crime, might be engaging with organizations of communities that are already supporting these families or spaces where these families already feel comfortable in, and having that conversation and facilitating those conversations in a way that those families are willing to engage with whatever information or whatever support that you want to provide for them. How do you recommend addressing the inclusion gap as education researchers? For example, oftentimes research involves interviews or studies of those already identified by a disability office. How do you gain the feedback and experience of those who do not identify? Adi?
Um, we do tend to miss those who are undiagnosed, disengaged, or kind of don't want to receive a label. But I think if our obviously, as you have said, if the research only includes those that are already identified, then we've designed a system that only works for those who are already visible. And I guess that's
Yeah.
already true because research already only relies on things that are kind of prominent, like disability registers. If you have a diagnosis, is there a school referral pathway or a clinical pathway? So
Mhm.
essentially, there's lots of people that haven't been diagnosed or assessed in a formal way, but they may have needs. So it's excluding essentially children who haven't been assessed, those who've been misidentified. So, like you said, it might be identified as behavior and not send because of the stigma surrounding Black boys, or those that don't engage with the services. So, I would suggest the best thing is to move beyond kind of the service or the online samples and reach out to actual people themselves rather than
Yeah.
relying on your SEND teams or your disability teams. LinkedIn is a good place to share that you would like to do some research and then see people who can respond. But then you can also um, find people like an Africanist ask us to share it, or Dr. Vivian does research, because we're trying to make sure that those people are being identified. Um, and I also think it's about the terms we use. Like I said, the SEND or the neurodivergent or the autistic is a very Western way of thinking. So rather than saying, are you neurodivergent? It's about using, I guess, different kind of ways of identifying identifying neurodivergent, or ways that people feel comfortable in identifying themselves. So some people don't like the example, I'm autistic, they like that I'm neurospicy, but other people don't like being called neurospicy. Um, so it's more about asking, what do you find helpful? What works for you? Um, Maybe do you experience some sensory things, or when it's loud, does it overwhelm you? Even the term sensory for some people can be, oh, I don't have a need. So change how we're asking or what we're saying. And like we said earlier, with the assessments, how we're assessing. Is it a standardized Western assessment of the questionnaire that we're asking, or does the researcher have any biases themselves on how they're going to interpret or review this data? Um, so it's about
Yeah.
looking at those own internal and outward barriers and making sure that we are making ourselves aware of them and doing our best to kind of identify them before we move forward and creating a new research or program.
Yeah, thank you. So Davison Gill says, "Thank you furthermore. My query was really directed at engaging with services like police, for example." Right, yeah. So there is a lot of, I mean, we've shared a lot of, biases and how that can inform behavior and profiling and all of that. So there is a lot of awareness, there's a lot of conversations, there's a lot of trainings that need to happen, which we're happy to engage with if we, if we need to have those conversations with the police, provide that training to organizations to share what the cultural context and how this might show or impact behaviors and representation within our communities. We're happy to do that. It's really in constant conversation, constant training, co-production, training development, training delivery, community awareness. That's where we are at this point, because there's really lack of awareness when it comes to engaging with people from underrepresented community all around. So we're happy to facilitate those conversations if we're called on. All right, please, while we wait for more questions, please, we would like you to take our survey. Your feedback matters to us. Let us know what you think about this training. Um, Let us know if there is anything you need us to do better in our next trainings or in our future trainings. Let us know what you found helpful and all of that. We have a bank of resources on our website. When you go on this page, we have videos, trainings from our past engagements, our past webinars. All the links, all the videos are on there. Please, if you're looking for resources, please go on that page. You'll find loads and loads of resources. This video would also go up on that page, and it would also be sent to each and every one of you who registered for this training. So what next? We would like to share a few bits of what we're doing and what next steps from this conversation will look like. So if you are on an organization or you're representing an organization and you're looking for expert-led neurodiversity trainings for your employee resource groups, we're happy to have a conversation with you and to deliver those trainings. If you're looking to adapt your inclusion policies, if you're looking to develop your inclusion policies, if you're looking to train your managers around engaging with underrepresented people from underrepresented communities, we're happy to facilitate that. All you need to do is to scan this QR code or use the link in the chat to register your interest, and we would reach out to you to have further conversations with you on what's how to proceed from that. Also, we are co-creating a teachers communication toolkit, and from everything we've shared here, we have seen some of the challenges that teachers, professionals in the education system face with engaging with families from underrepresented community, and we want to bridge that gap. but we don't want to do it for you. Our style is to hear from you, know what your bespoke challenges are, and create something that speaks to those challenges and those needs. So we want to collaborate with you to actually create those communication toolkits so that it would really, really speak to your needs, and it will really, really solve the challenges, the peculiar challenges you're having in your schools and institutions. So please, if you want to be part of the co-production, please either scan the QR code or use the link in the chat to register your interest, and we would also reach out to you to have those conversations. Please do follow us on all our social media. We're very active. We're constantly sharing information. LinkedIn, Facebook, Instagram, Twitter. Do reach out to us, and our website is www.africanist.org. Please do engage. We have a lot of resources on our website. Do follow us, and we're looking forward to working with many of you. Do reach out, and we would engage and we would support in any way that we can. Thank you once again for coming and engaging and listening to us and sharing. Thank you. Do we still have questions? We have a few minutes to take a few questions if we still have questions. And you can unmute yourself to share any reflections. I think we have about 6 minutes. If you have any reflections, if you have any questions, please do share before we wrap up. Right, thank you. Thank you so much. There are lots and lots of thank yous in the chat. Thank you for coming. Thank you. We're happy that you found this insightful and you found the information helpful. And we look forward to seeing some of you again in some of our webinars and working together with a lot of you in the future. Thank you.